Let me tell you something I learned after decades in medicine. The most dangerous moment in a person's day after the age of 60 is not what most people think. It is not the heavy meal, not the lack of exercise, not even the late night habits that slowly accumulate over the years. It is the morning. The first hour after waking up quietly shapes the entire biology of the day, and yet it is the one moment most people treat on autopilot. I have seen this pattern again and again in patients who believed they were doing everything right, taking their medications, attending checkups, following general advice, and still feeling their energy decline, their weight increase, their sleep worsen, their mind becoming less sharp. And when I asked them to walk me through their morning step by step, what I heard was almost always the same story. Rushing out of bed, reaching immediately for stimulation, skipping small but essential signals the body was trying to send. No awareness, no intention, just habit. I say this without judgment because it is human, but it is also something that can quietly shorten the quality of your life. After many years as a doctor, I began to notice a pattern. People who age with strength, clarity, and resilience tend to treat their mornings differently. Not perfectly, not obsessively, but intentionally. They understand something that is rarely explained clearly. The body after 60 is not fragile, but it is more sensitive to rhythm. The systems that regulate blood pressure, blood sugar, hydration, inflammation, and even mood are more dependent on how the day begins. What you do in that first hour is not just a routine. It is a message to your entire organism. It tells your heart how hard it needs to work. It tells your brain whether it is entering a state of alertness or stress. It tells your metabolism whether to stabilize or spike. I want you to think about this for a moment. When you wake up, what is the first thing you do, really? Not what you think you should be doing, but what actually happens. Do you sit up slowly and notice your breathing, or do you jump straight into movement? Do you hydrate your body, or do you go straight to coffee? Do you expose your eyes to natural light, or do you look at a screen? These small choices are not small at all. They are signals, and after 60, signals matter more than ever. One of the most common mistakes I've observed is the immediate rush into stimulation. Many people wake up and within seconds they are checking messages, turning on the television, or flooding their system with caffeine before their body has even stabilized from sleep. What they do not realize is that during sleep, the body enters a state of relative dehydration. Blood becomes slightly thicker, circulation slightly slower, and the nervous system transitions from rest to alertness in a delicate way. When you interrupt this process abruptly, you are creating unnecessary stress on the cardiovascular system. It may not be noticeable at first, but over time, it accumulates. I remember a patient who once told me they felt dizzy every morning, just for a few seconds after standing up. They assumed it was normal aging. But when we looked closely at their routine, they were waking up and immediately standing, walking quickly, and starting their day without pause. There was no transition, no moment for the body to recalibrate. When they began to simply sit at the edge of the bed for a minute, breathe, and then stand slowly, the dizziness disappeared. Nothing dramatic, no medication, just respect for the body's rhythm. Another pattern I have seen is the habit of skipping hydration. People often say they are not thirsty in the morning, so they do not drink water. But thirst is not always a reliable signal, especially as we age. The body can be dehydrated without a strong sensation of thirst. And dehydration, even mild, can affect blood pressure, kidney function, and cognitive clarity. I have seen individuals who felt fatigued, foggy, and even slightly anxious in the morning. only to realize that a simple glass of water upon waking made a noticeable difference within days. It is not magic, it is physiology. And then there is the issue of light. Natural light in the morning is one of the most powerful regulators of your internal clock. It tells your brain that the day has begun, that it is time to release the right hormones, to increase alertness, to prepare the body for activity. Yet many people wake up and remain in dim environments, or worse, they expose their eyes to artificial blue light from screens before seeing natural daylight. Over time, this disrupts sleep patterns, mood, and energy levels. I have seen patients struggle with insomnia for years, trying different medications, when the solution began with something as simple as stepping outside in the morning for a few minutes. Now let me ask you something gently. When was the last time you allowed your morning to be quiet, not empty, not boring, but calm? A moment where you are present in your own body before the world begins to demand your attention. This is not about meditation in a formal sense. It is about awareness, feeling your breath, noticing how your body feels, giving yourself a chance to start the day with intention rather than reaction. There is also something important to understand about movement. After 60, the body benefits from movement early in the day, but not aggressive movement. The joints, muscles, and connective tissues need to be awakened gradually. Sudden, intense activity can increase the risk of strain or injury, but gentle stretching, a short walk, or simple mobility exercises can improve circulation, reduce stiffness, and even enhance mood. I have seen people who thought their morning stiffness was inevitable, only to discover that a few minutes of gentle movement transformed how they felt for the rest of the day. And then there is breakfast. This is a topic filled with confusion. Some people skip it entirely. Others consume foods that cause rapid spikes in blood sugar. What matters most is not following a trend, but understanding how your body responds. After 60, the ability to regulate blood sugar can become less efficient. A breakfast that is too high in refined carbohydrates can lead to a quick rise and then a sharp drop, leaving you tired and irritable. On the other hand, a balanced meal with protein, healthy fats, and fiber can provide stable energy and support metabolic health. I have seen dramatic improvements in energy and focus simply by adjusting the composition of the first meal of the day. Most people only realize this when it is already too late. They wait until they feel consistently tired, until their lab results begin to change, until their sleep becomes fragmented, until their memory feels less reliable. But the truth is, these changes do not happen suddenly. They are the result of small patterns repeated over years. And the morning is one of the most powerful places to change those patterns. I often think of the morning as a kind of doorway. Each day you step through it, carrying with you the habits you have built. The body responds to consistency. It learns from repetition. If your mornings are chaotic, rushed, and disconnected, your body learns to operate in a state of low-level stress. If your mornings are calm, intentional, and supportive, your body learns to operate with stability and resilience. Let me share something else I have observed. People who maintain their independence and vitality into later years are not necessarily those who followed strict rules. They are those who developed a relationship with their own body. They paid attention. They adjusted. They respected signals instead of ignoring them. And very often, this relationship was built in the quiet moments of the morning. So I invite you to reflect, not with pressure, but with curiosity. What would happen if you gave your morning just a little more care? Not an hour of complicated routines, but a few intentional actions. Waking up without rushing, drinking water, allowing light into your eyes, moving your body gently, eating in a way that supports stability rather than spikes, pausing even briefly to be aware of yourself. After decades in medicine, I can tell you this with confidence. Longevity is not built in grand gestures. It is built in small, consistent choices that respect the way the body is designed to function. And the morning is where many of those choices begin. You do not need perfection. You need awareness. You need consistency. You need a willingness to listen to your body rather than override it. Because the truth is simple, and I say this with all the experience I have gathered over the years. The way you begin your day is often the way your body will carry you through the rest of your life. And when you learn to begin your mornings with care, patience, and intention, you are not just starting a day, you are quietly extending the quality of your years.